Welcome to Spill the Milk. Today, I am so excited because we are going to talk about mental health and just being a new mom and how all those things flow together. My name's Nicki. I'm a registered nurse. I'm also a board certified lactation consultant with 20 years experience in mom and baby world. I want you to know that motherhood flips your entire world overnight. And somehow society still expects moms to smile, bounce back, and enjoy every moment. The truth, so many mothers are struggling silently, not because they're failing, but because they're just human. Today, I'm sitting down with someone who gets that on the deepest level. This is Linda. She's a certified midwife and a psychiatric nurse practitioner who has spent years supporting women through pregnancy, birth, and the emotional storm that can follow. Together today, we're going to pull back the curtain on what new moms really experience mentally and emotionally. The anxiety that hits at 2 a.m., the intrusive thoughts no one warns you about, the pressure to be grateful while you're barely hanging on, and how to ask others for help before you reach a breaking point. So if you're a new mom who feels overwhelmed, exhausted, scared, or not like yourself, this conversation is for you. You're not weak. You're not dramatic. You're not broken. You are carrying more than anyone can see, and you deserve support. So let's talk about the real postpartum mental load. I want to introduce to you Linda. And before we dive in, I want to tell you a little bit and allow her to tell you a little bit about her background. So welcome, Linda. Hello.
Hi, thank you so much for having me, Nick. I'm very happy to be here. I'm a mom of six. I have six children. Thank God they're all grown adults now, highly functioning. I have 10 grandchildren. I started professionally as a women's advocate. I worked at a shelter for women and children experiencing domestic violence. I've been a midwife for almost 30 years. I've attended births at home, birth center, and the hospital. And now I'm working as a psychiatric nurse practitioner.
That's awesome.
Yeah.
So what made you do that transition from midwifery to psychiatric nurse practitioner?
Um, so that's a really great question. After like many years of attending births in and out of the hospital, it was very clear to me that the physiological processes occurring during pregnancy, occurring during labor, are deeply, deeply interconnected with the mom's emotional state. And even back in the day when I was doing home births, we used to go to people's homes for their home visit, and we would do like a birth drama, which was always so amazing to me. It was such a great experience to watch. So essentially, we would show up and as if the mom was in labor, and the mom, was supposed to behave like she was in labor, and she could totally direct her labor to be whatever she wanted it to be. So she could say, I'm ready to push, and we would, run in and set everything up and guide her through her enactment of what her visualization for her birth was. And and that didn't really happen. You would think like they that more women would choose to do that, but it was so interesting that what they really did in their birth drama really was reflected in their actual birth experience. So I just remember this one person, and she had been, she had had a history of childhood sexual abuse, and she had had previous cesarean sections, really wanted to try for vaginal birth. And so we came to her house, and she wasn't she wasn't really acting like she was in labor. So I said to her, "So are you feeling contractions? Like what's happening?" And she was like, "Oh, they're kind of intermittent." And what happens in real labor is sometimes if we get there and it's early and it doesn't seem like, we really should be there, it's like too early, she's not really active. We'll go someplace, nearby. Like we'll go at the mall or whatever. We'll spend some time until she calls us back. So that's what we did. We said, okay, well, you think if it's too early for us to be here, we'll go, we'll stay locally and we'll come back. And so we go, and we're like there for a few hours, and we're thinking, is she going to call us? Like, is this, what's happening? So, so finally she called us. And so we come back, and now she's kind of wrapped her head around, she's going to be in labor. And it was still, we really kind of had to like So, are you feeling any urge to push? Like, what's happening? Tell us what's going on in your body. We really had to keep kind of like nudging her. And even when she was, fully dilated, we said, okay, well, sometimes not everyone has to push right away. We'll leave you alone. And we left her alone actually for a long time. And because she was not telling us that she had to push or she wanted to push. And finally, we kind of, again, kind of like gently nudged her because it was like, usually these birth dramas are kind of like, 2 to 4 hours or something. We were like getting into like 8 hours of this. So she finally said, okay, I think I can push. And even, like a lot of moms will just really like really grunt and really like, even if they've never had a baby, they'll do what they saw on TV or they'll do what they think they need to, whether it's gentle pushing, whatever. She was kind of going, like she wasn't really
Mhm.
pushing. And so anyway, we finally said, oh, here comes your baby, and gave her baby and handed her baby and helped her, acclimate to that immediate postpartum thing. But it was really felt artificial, like we kind of made her have this baby. And in reality, when she did go into labor, we were with her at home for a long time before we took her to the hospital, and tons of time at the hospital, all the things, walking, doing all the things that we do as midwives. And unfortunately, she did when she got to fully dilated and just refused to push, could not tolerate that feeling
Mhm.
of pushing, which is a really intense feeling. And for a lot of women who are survivors of sexual abuse, it's just something that they just can't. Not everybody, but there's a percentage of people that just cannot tolerate that feeling. So it was very interesting that, um, what people do in their birth traumas was really reflected. So that really kind of spurred me on to learning more about women's mental health and pregnancy and postpartum depression, anxiety, which all can happen also in pregnancy. Yeah.
Yeah, so I
So,
love this because it was kind of like a rehearsal, right? So, with that being said, you got to know how shy she kind of was about her body,
right.
and it was duplicated in her labor, really. And, I do this with moms when they talk about preparing to go back to work, right? All the anxiety producing thoughts that happen about how much milk do I send? What do I do? How much, all the things. I call them dry runs, right? You don't
Right.
have to leave your baby, but pretend like you're at work. Baby's going to get bottles and you're going to pump. So you can have some of those practice moments to help calm your anxious thoughts for when it really happens. And it also gave like your patient an opportunity to see how you function in that similar setting. So I love this, but what you also were able to connect is that mental health aspect. And this is again one of the most important topics I think that we need to focus on in pregnancy and keep normalizing what we can about offering help and support to moms. So I just want to kind of clear up the confusion of what postpartum depression really is. So can you kind of like give us like us some information on it, maybe not too textbooky, and that's what I appreciate about you is because 'cause you're not real textbooky, you make it kinda real. So can you give us just some information on what postpartum depression it really is?
Absolutely. So, what is very normal and common is what's frequently referred to as like the baby blues. And that normally happens someplace between 3 and 5 days, up to 2 weeks. And it's kind of like you're, still well bonded with your baby, but you might be crying more frequently than you normally do. It's very temporary. It will go away on its own, but you're feeling like maybe more anxious, maybe more a little sad, even though you're still bonded with your baby, you're nursing your baby, things are going fairly well. But beyond, if that baby blues episode kind of goes longer than 2 weeks, then you're moving into postpartum depression. And postpartum depression is different. It can happen anytime. Sometimes it does happen early in the postpartum period, but sometimes it doesn't happen until 3, 4, 5 months later when mom might have a lot less support than she previously had. She's even more sleep deprived than she had been. A lot of times her partner is going back to work and she has less support at home. The grandmas, if they were coming, if they live close, now they have to get back to their lives. They're not able to stay
Mm.
as long or as frequently. So there's a lot of combination of things. And also mom is thinking, there's a lot of factors that go into postpartum depression, right? Like um the withdrawal from the pregnancy hormones is a big thing. Kind of also a change in mom's identity. Like, who am I? Like,
Ah.
am I a good mom? How am I going to be a good mom? What happened to the me that I was before I had my baby? There's all these body changes. Everybody has like their own body image of what who they were, what their body looked like before pregnancy, which is very different than what it looks like, even 5 months postpartum.
Mhm.
It takes a while to and a lot of women, I would say most women don't get back to like that body that they had before they were pregnant because it's different now. You've had a baby, you've pushed a baby out, or you've had a cesarean section. So there's a lot of identity things going on. Typically, postpartum depression is characterized by not enjoying the things that you normally do, or not wanting to do the things that you normally do, crying more frequently, having a lot of anxious thoughts. A certain level of anxiety is normal. Like, I'm walking down the stairs, what if I drop my baby? So you're more careful, you hold on to the railing. But sometimes it can get really debilitating. Like, I had a mom that wouldn't go upstairs. She and her baby slept downstairs because she just could not think about going up and down the stairs carrying her baby. She couldn't move past that.
So it's
So
when
there
it's so what can I just wanna kinda add in here. So when it's
yeah,
not allowing you to do everyday tasks,
right,
common everyday tasks, when your thoughts are becoming, like you said, debilitating to everyday function.
right.
Okay. Okay.
Yeah.
Yeah. Go on. Sorry, I interrupted.
No, that's okay. Well, a lot of times we do think of postpartum depression as, the more serious things like having like intrusive thoughts that are very, very disturbing to me, or I'm having anxiety that's interfering with my ability to do my daily functions, or my depression is so severe that I can't get out of bed. I'm not taking care of myself. But I really want to encourage women to get help before that. Like, when they
Mhm.
see themselves not functioning as well as they used to function, or they see themselves just not really enjoying things, and not really getting, having that real desire to get up and do things, not being motivated to do things. Those are all like earlier signs. Like, don't wait till the baby's screaming before you try to before you try to feed them, like, look at those earlier signs of depression before, you wait till things are really in a dark place.
So, some things I really like that you just said that actually gave me a little bit of education was that it may not be there for a little while, but may creep in later due to situations. Dad going back to work or their partner going back to work. Grandma's leaving, right? This tugs at both you and I, our hearts. Um, but just a change in they're trying to situation, right? Before they were able to handle where they were because they weren't having to handle as much, and then some of those helpers kind of start to back away. And while there were underlying things there, it was able to be managed because there wasn't a heavier load. And when you said that, it kind of went to that. It doesn't have to happen right away. It can happen at a later date, but there's usually a situation that arose. But then it goes back to there were already underlying things that were missed. I teach all the time. When your baby's crying, it's a late sign of hunger. We should have done something prior. And what you're saying is mom breaking down is a late sign. There was something prior. So, can you give us some things about what may be there prior to that we could identify early so that those helpers might stay longer or might look into more things?
Right. So that's a really good point. So there are definitely signs. One of which, and there's a lot of overlap. So I always ask moms, "How are you sleeping?" And they're like, "Well, I have a newborn. I'm not sleeping." But even when the baby is napping, like, can you lay down and take a nap also? Like, if somebody were watching the baby for you, are you able to fall asleep or are you not able to fall asleep? That's a big one. Are you crying like a lot more than you normally cry? Is that still going on? Are you finding like you're super irritable and that's not usually you? Some women will even say, I have postpartum rage, which
Mm,
is really an expression of like really severe anxiety.
mm,
You know,
yeah.
some yeah, some moms have, like obsessive compulsive disorder where it's beyond like normal anxiety, like not being able to go up and down the stairs or developing like an ongoing fear of, they don't want anyone to see their baby because of germs, or they're afraid to go to out of the house with the baby because of germs. So their world is getting smaller and smaller. And it happens gradually over time, but if it's not treated, if it's not addressed, then that's a problem.
So some of the things you said just hit near and dear to my heart. As you know, you and I have discussed, I suffered a fair amount of postpartum depression and anxiety. Even perinatally, it showed up. And I remember when you said, and again, you just said it, but that when your baby naps and there are people there to watch your baby, you still can't nap.
Right,
An example
right,
of an intrusive thought that would happen to me because of my anxiety was I can't sleep even though my mom is staring at my child and she's promised me she's going to. Because what if my mom tries to give my 2-day-old a pacifier and then it ruins my breastfeeding experience and then da 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 da. And
right,
logically, I had no pacifiers in my home. So how could my
right,
mother grab that pacifier? But those anxious thoughts didn't allow me to sleep.
right.
That's a that one that one caused a little bit of emotional response from me. So I loved that from you. So but there's things that maybe pre-existed before, right? Before this baby even arrived that are maybe
Right.
telltale signs that a mom needs to be monitored.
Right, absolutely. So if mom has had the best time to treat postpartum depression is before you even get pregnant.
Mhm.
Right. If you have a history of depression, especially if you've had a few episodes of depression, that's a real risk factor for developing postpartum depression and also pregnant and depression during pregnancy. We can call the whole period like perinatal mood disorders.
Mhm.
So if you have a history, especially a history of, several episodes of depression, that's a risk factor for postpartum depression. And it's also potentially a risk factor for postpartum bipolar disorder. Especially if you've had like those episodes of depression starting in like the late teen years, like age 15 to 19, and that's kind of repeated in college and repeated a few other times, because a lot of times bipolar disorder appears for the first time postpartum as a mania. And that person may never have had a previous manic episode. They've only shown depressive episodes. So,
Wow.
previous episodes of depression are a risk factor for both a manic episode postpartum and as well as postpartum depression.
Wow. So, what I'm hearing you say definitely is if you've got a history, you need to jump on things as part of your I'm getting ready to have a baby plan.
Absolutely. It should really be part of preconception planning. And if you've been treated before with medication, you can go back on to that same medication if it's worked for you. If you've never had, yeah, unless it was something that's an absolute contraindication for pregnancy, but for somebody that's never been on medication, typically sertraline, which is also Zoloft, is a very safe. It's the most well-studied medication. Can be started in pregnancy, um, and that works for a lot of people. Other risk factors for depression would be like a really traumatic birth experience, unexpected birth experience. You were planning, a beautiful water birth or some natural birth, and you ended up with a cesarean section unexpectedly, or there's complication with the baby that was not expected. Those are also risk factors for postpartum depression.
And I hear you when you say this because we need moms to know it's not their fault. They didn't create this. They didn't create this. But in some of what you got done saying, you did hit on medications a little bit. And of course, you know, I live in breastfeeding land. So a lot of moms get worried about taking medications that's dangerous while breastfeeding. Is it safer to avoid medication or is it not? And what do we do to help these mamas?
Right. So there's so much resistance to taking medications in pregnancy. Well, taking medications, period. There's a lot of stigma around medication. And uh, d- depression, anxiety, bipolar disorder, these are all chemical problems in the brain, right? Bipolar is also an anatomical problem in your brain. So just like we would not blame somebody for having high blood pressure or blame somebody for having diabetes, you know, there's no blame that should be associated with any kind of mood disorder, no matter where you are in whatever stage of life you're in. This is a chemical thing. And the good news is we can treat it. A lot of people are, when they're pregnant, when they're breastfeeding, are very worried about taking medications. And the truth is, there are a lot of well studied medications for depression, for anxiety. There's treatment for bipolar disorder if you're pregnant. And the data really supports um, for a lot of women that treatment is really a safer way to go than untreated mental illness. Untreated mood disorders are also dangerous in pregnancy and breastfeeding because it has a physiological effect on moms, right? So and I've seen this in women so many times. I've had moms just cold turkey, I'm going off my medication, and then they slowly start to, get worse and worse. I had one mom who did. I said, okay, if you really want to get off your medication, we'll taper you down. And then she was just not functional. She wasn't getting out of bed. She wasn't feeding herself. And then we had to, have like a team intervention, family intervention, and get her, back on medication so she could function. And there are medical risks too for not treating. Women have lower birth weight babies. They're at higher risk for preeclampsia. They're at a higher risk for low birth weight babies. So there are definitely physical effects for the baby.
So, aside from the medication approach, which we know there's a ton out there, there's a ton of great resources. What other tools or treatments are there for postpartum depression?
So that's a great question. And sometimes when you're in the middle of it, someone telling you that you should go outside and take a walk in the sunshine seems like very trivializing. It seems like very condescending, being told that you should meditate. Like these are all great things. And exercising is a great thing. Getting out with your baby walking every day is amazing. These are all wonderful things. But sometimes until you are on some medication and feeling better, you can't really imagine like getting off the couch and going outside. Like even
Mhm,
getting up and taking a shower, it seems like a huge ordeal.
mhm,
So so sometimes medication really needs to be addressed first, and then you can optimize the effect of the medication by then including, oh yeah, okay, I could go out. I am feeling like I could go outside with my baby and take a
mhm,
walk. You know what? I do feel more like myself. I do want to go and do a yoga class or do yoga on an app or something like that. I think I could do a meditation. That kind of does make sense to me. So sometimes you have to really step in first, but they're all just tools in the toolbox. And of course, therapy is really important. Having somebody to talk to is really important.
So again, here comes an emotional response from me. I remember, so with my fourth, I've shared this with you and I've shared it with others. I had suicidal ideations. I couldn't get out of bed. The only reason I got out of bed was to use the bathroom and return to bed. And that got to the point where I wasn't even using the bathroom because I wasn't nourishing my body. And I remember calling the
Mm.
doctor's office and just saying, I can't get out of bed. And I was told And you're right, it was condescending in the way that I was told. I was told, you need to just force yourself up to get out of bed, get up and put some makeup on and do your hair. And I remember in that moment thinking, if I can barely get out of bed to urinate, how am I going to get out of bed? And what I love so much about what you said was sometimes medication is the first line of defense because that's going to allow those other things, those quote trivial things that we think are condescending or whatever, to be able to be employed. So I loved that from you, but it brought me back to that nurse on the phone, get up and put some makeup on. And I remember just how
Right.
that made me feel. I just love your words, Linda. I love how you are prophylactically kind of going, yes, that's good advice. But however, when we get too deep, that advice isn't going to be helpful. So I just, again, okay, so how can anxiety or depression interfere with breastfeeding? Because you knew I was going to go here, right? Like breastfeeding is my jam. How can it interfere with breastfeeding?
So it can interfere with breastfeeding in that in so many ways. First of all, if you're not treated for your anxiety and depression, you probably aren't good. And there's studies that bear this out. You're probably not going to have a successful breastfeeding. You're going to quit sooner than you would have if you had opted to take some sort of medication. And again, there's lots of safe options for medication with breastfeeding. Um, it even if you have enough milk, it's going to physiologically, you're not going to have as strong as a milk ejection reflex. Your milk isn't going to let down as easily because you're anxious. You're holding your whole body is tighter. You're not connecting as well with your baby. It can interfere with your ability to bond with your baby. Um, so many things, even just the motivation. And there's a lot of guilt around this. Like a lot of people try really hard to get pregnant, going through the whole IVF process, and then they're pregnant, holding their baby, and there's so much guilt around that. Motherhood, even women that haven't gone through IVF and they're pregnant. There's this whole image we have of moms that everything should be daisies and joy and happiness. And that doesn't happen for everyone. And there can be like a real difficulty with bonding. So if you're noticing things like that, feelings like that, like not really feeling connected, it's going to be really hard to breastfeed your baby if you're not feeling that. And that's a really important time to reach out to family, to reach out
Mhm.
to your doctor. And you know what? If your doctor is not addressing it, I just had this with a postpartum mom. She told her pediatrician, I'm not doing well. I was doing well before, and now my baby's almost 5 months old, and I feel worse. I'm not doing well. And the pediatrician didn't address that at all.
Mm,
If you're not being listened to, you need to find a new doctor. You need to
mhm.
keep going to the next person, tell someone in your family, enlist support from other people if you're not being heard.
Yeah, and I think that is huge because I think we just inherently trust someone's opinion instead of we have these instincts. We have these things, but when we are told that our instincts need to calm down, hold on, calm down. Whoa, we're being, and here's the word of 2025, right? Gaslit. You know, we're being told that our feelings aren't valid or not important. And I think about that mom that you just shared. How hard was it for her to even say she was struggling? What if she
Right,
spent days getting up the courage to say, I'm struggling, and boom, it was dismissed? And
right,
my heart, like, those are the things that I just, in my practice, and it's probably been, gosh, 12 years ago, 13 years ago, I don't know, where I had a great family that came in to see me. We worked on breastfeeding. It was the mother-in-law, the dad, and the mom and the baby. And they all came in as this group. And, we worked on some things. And then I got a call later to see the mom again in about 2 weeks. And it was from the mother-in-law, which I thought, oh my gosh, that's okay. We have a very involved mother-in-law. Great. So they all come in and everybody's kind of talking. And I said, okay, well, the baby looks a little hungry. Let's feed the baby. And the mother-in-law was holding the baby. So that was kind of my key to, hey, let's give the baby to mom. So the mother in law goes and changes the
Right.
baby's diaper, undresses the baby. She undoes the mom's bra, and mom is
Wow.
sitting there with her hands down, and the baby's put on the mom's lap. And I watch the mom being encouraged to bend over and feed the baby. We didn't have a baby feeding problem. We had a mom who was nearing the end of her rope. And
Right.
everyone was there to help her, but not with the kind of help she needed. And trying
Right.
to get a hold of a provider to listen to me in that moment was hard because I'm sure
Right.
when there was the pediatrician appointment, everybody went in, everybody did the thing, and the mom just sat there. No one paid attention to her. So,
Right.
this is why I love some of the stories you share because you've seen it in every setting. And it's dangerous, right? Postpartum depression's dangerous.
Postpartum depression is dangerous. And another thing that that you touched on is it's really hard to bring these up with professionals because it's hard to say it's hard to say that you need help, right? That's difficult. But for new moms, it's really hard because there's this kind of underlying fear that I'm going to be judged that I'm not a good enough mom. Someone's going to take my baby away from me if I tell them that I'm struggling. And that is a huge, huge barrier to care. So we as professionals have to really tune into that and meet women where they are and get the help and the support that they need for,
Yeah.
for our clients. It's really important.
That statement,
And
you're scared
and
somebody's gonna take your baby. That one, I'm crying now, because that one's the scariest one ever, and I've seen moms experience it, and I remember feeling that way. So, yeah. So warning signs, we've went over them, right? Like, we've talked about them, and I want you to feel free to add if you have something else you wanted to add on. I know I'm really good at interrupting, sorry.
no, 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 you're bringing in such great information for moms. I think like the big red flags, of course, having thoughts of suicidal ideation, that's a huge red flag because we don't know when or if somebody will act on that. Right. So that's something that we need to take really seriously. And there's a lot more information that we need to gather from our mom who's telling us this, because that's really hard to tell somebody. Do they have a plan? Do they have a plan? If they can think of something that they could do, then that's an even more elevation. If they have intent, like if I ask somebody, well, do you think that you really would do that? And they're like, well, I don't know. Um, Another huge red flag. So then you're kind of moving into like this is really an emergency. Like I have to get care for this woman like right now.
Mhm.
So if we have things like that, those are like emergencies, like right now we need to get care. Um, Hopefully we can intervene before it gets to that kind of thing. And there is a really important and valuable resource called Postpartum International.
Oh, great.
They have a website. You can click on that no matter where you are in the country and find a provider in your area. They have therapists and they have psychiatrists. And for healthcare providers that are prescribers, if you don't know, if you live in a part of the country where there's not a reproductive psychiatrist or not somebody that's skilled in prescribing during pregnancy, during breastfeeding, you can go on there. They have a resource for professionals where you can get a consultation with their reproductive psychiatrist, and they will help
Mm.
you tease out what medication might be appropriate for your patient.
I love
So
this.
they're a really important resource. Yeah,
But you're also a resource.
yeah,
Moms can reach out to you, correct?
absolutely. I'm licensed in New York, New Jersey, and Maryland. My website is sensible.psychmeds.com. I had to think about that for a second.
I will also list
And
this in the description on the website, and I will also have a link that moms can go to and find you. What else do you have? You have social
oh, great.
media?
Thank you. I have social media. I'm Linda Perry, Psych NP on Instagram and TikTok. And my good old fashioned phone is 862-453-9229. And
Wow.
one thing that I'm just thinking of that we didn't touch on is women thinking about medication like that it's going to change like who they really are. And
Oh,
so
I
I
love
really
this.
want to give women like reassurance that I have so many women that come and they're resistant at first, and it might take 2, 3, 4 visits until they get to the point where they're like, I've tried all the things and nothing is really working. I've been in therapy for a really long time. It's not enough. I'm still feeling not myself. And they start on even the lowest dose of sertraline. And they're like, oh my gosh, I don't know why I didn't do this sooner. I wish I had done this sooner because I feel like myself. Like my life is still stressful, but now I can handle it. Now
Mhm.
I can say, okay, like not everything is not like catastrophic. Like I realize that this is a stage, this is not forever. And that's really important for moms to remember. Like your baby will sleep. Eventually, your baby is going to sleep, and you are also going to sleep. This nursing difficulty or whatever your difficulty is that you're facing, this is not forever. This is just a stage. And stages with babies come and go all the time. And medication can just really make that a little easier.
So I did kind of, I know when we spoke live on TikTok, we did talk about some medications that aren't necessarily quote medications, but herbs or supplements to help with some things. Could you just kind of touch on a few of them that moms who maybe want to try something alternatively before they go to something like sertraline? Could you give us some of those?
Sure. Yeah, absolutely. One of my favorites for anxiety is a really well studied product called Lavella. It's a lavender oil developed in Germany, actually. In Europe, lavender is its own industry, and it's great for anxious times. You can just take it on an as needed basis. Um, and it helps kind of just quiet all that down. You can take 80 to 160 milligrams of Lavella.
Okay.
And it's also great if you're super anxious and that's keeping you from sleeping. Um, it can also help with sleep. The biggest side effect of the lavender is you might burp lavender, which is a very bizarre experience, but it's pretty manageable.
Okay. Yeah. And so,
Yeah. Uh,
as you're listing these things, I'm going to add them into the description of the podcast so moms can have them just to be reminded. So, so Lavella, what you got next?
Lion's mane is very helpful for anxiety and depression. You can take 1.5 to 3 grams a day. It's safe. I'm a huge proponent of medicinal mushrooms. I'm not talking about psilocybin or psychedelics, but medicinal mushrooms um, are very helpful, especially lion's mane. You can take it in liquid. You can take it in capsules. It also comes in a powder. I personally love it in my coffee. It's delicious.
Mm.
But, try them out, see what works for you. And another very common one is L-theanine. L-theanine is one of the components in green tea. So green tea has caffeine, as we all know, it gives us energy, but it also has L-theanine in it, which is the component that kind of zens us out when we have a cup of green tea and we feel very relaxed. That's the L-theanine kicking in. Um, so that's something that you could take. It's when you take it in a pill, it's not very bioavailable. You have to take the sun-theanine version of it. Um, so you can reach out to me and I can help you get the right form of L-theanine. But if
I
it
love
says
that.
sun-theanine, you're good.
Oh,
Yeah.
great. That's awesome. Do you have any more? Can I squeeze one more out of you? Do you have
Um,
another
those
one?
are um those are the and sleep. I will sometimes prescribe sleep. L-theanine is very good for sleep also. It does not really make you tired per se, but it's very good for if you're the type of person that's not sleeping because you're having like all the thoughts, like you're rehashing what happened today and ruminating on that, or you're worried about what's going to happen tomorrow. You have a big meeting or something. So that's something that can help kind of just quiet all those thoughts so you can just put them aside and go to sleep. Yeah.
This has been so amazing. I just love hearing from you and your experiences. What is the biggest thing you want a new mom who might be battling some postpartum depression to know?
The first thing is this is not your fault. Don't feel guilty about this. This is a chemical problem. And secondly, tell somebody. If the first person is not listening to you, then tell the next person. Tell your partner, tell your mother, tell your sister, tell your midwife, your OB, your pediatrician. Keep telling people until somebody listens to you. If you're having suicidal thoughts, you can call or text 988 is the suicide hotline. So please use that if you're having those kind of thoughts. Sleep whenever your baby sleeps, if you can. You can only do this with your first baby. So take advantage of it because your second baby, you're going to have a toddler.
Yeah.
And reach out to your support network. If you're not getting enough sleep, ask somebody, can you come over today? I really need to nap. I was up all night and I really need to sleep. It's not a sign of weakness to ask for help. It's a sign of strength to recognize that you need the support and then to have the courage to ask for it is a sign of strength, not weakness. And when you're feeling up to it, do get outside, go in the sunshine, take your baby for a walk. If it's cold, put the baby, bundle the baby up. I had my first baby in February living in New York State. It was freezing
Oh,
cold. And I was like stuck at home. I didn't have a car. And, it was not like a walkable town. I didn't have a friend next door. So I would just put my baby in the stroller and pile all these blankets on her. And we would just go for a walk. And it was great. Sometimes you just need to get out of the house and take care of yourself and remember who you were before you became a mother.
right.
Like honor that person and don't say, well, that person's gone. That person, I can't be that person now. I can only be a mom because you just have to be yourself. And so
That's
remember who that person was and don't hide that away.
I love all of this. Thank you so much, Linda, for meeting with me today and helping and supporting moms. And again, everything we talked about today, resources and things like that, I'll put in the description of the podcast. I'll put in your information so moms can reach out to you because you virtually see moms, correct?
I have a hybrid practice. I see women virtually, and I also see women in person. I'm in
Great.
northern New Jersey.
Okay, great.
Yeah,
All
not far
right.
from New York City. Yeah.
Well, thank you so much again. And I look forward to all that you have to offer for moms and just watching you grow in your practice.
Thank you so much, Nikki, for having me. I really appreciate it. Have a wonderful weekend.
You too. Bye bye.
Bye.